Weight loss is not as easy as eating less and moving more. Let's talk about what is a GLP-1. We don't need to be too scared by some of the misinformation that's out there. We don't need to judge someone when it comes to their entire health risk. We take a holistic approach. We help patients understand the underlying factors contributing to their weight. There is a lot of stigma when it comes to being a weight loss doctor. Would you say to someone who's taking the asthma puffer, I bet you're taking it for something else? Many patients are given an opportunity to be able to change their behavior. Strength training is something that is so important when it comes to the weight loss journey. Having these kind of open and honest conversations is the best way to learn about what might suit you.
How long should we be on these medications? Is it safe to be on them long term, and is that dangerous? This is Fernwood Unfiltered, the podcast for straight up expert-backed advice for women's health and fitness. And oh boy, do we have a wonderful episode for you today. If you have ever felt frustrated by the quote, just eat less, move more type of advice, or you've seen the effects of Ozempic and wondered whether GLP-1s are right for you, or wished you had clearer stigma-free guidance on weight, on hormones and long-term health, this episode is going to be your go-to. Dr Angela Kwong is an Australian GP and leading expert in medically supervised weight loss. She's the founder of Enlighten Me, a program built around a full care team of GPs, an exercise physiologist and a nutritionist, all working to help women achieve long-term sustainable results. Angela is the New South Wales state lead for the RACGP's obesity management group and a driving force behind better education in this space, running GP support groups and leading events like the Australian Weight Loss Summit. Dr. Angela Kwong, welcome to the podcast.
Thank you so much for having me here today.
That was a very, very long list of achievements in your introduction. Are you tired by achieving all of that?
I'm very energized to be here today.
I'm so glad to hear it. And I'm so excited for us to talk about this, because I feel that if there's one theme that we like to promote here on Fernwood Unfiltered, it's about empowering yourself. And through that, a lot of time that happens a lot of the time through knowledge. And I think that this area in particular is one that we've all been kind of wondering about and are either unsure, we have positive feelings, negative feelings about it, how we could feel too. So I'm so excited for us to have this discussion. But Angela, before we get into that, if there is one key takeaway you would like our listener to get from this conversation, what would it be?
It would be that weight loss is not as easy as eating less and moving more. I know that we're all literally fed that information from day one. And anyone who you go to for information will say, oh, it's as easy as eating less and moving more. It's really not, especially for us women. We are complex beings. We are products of our work function, our family function. Many of us are juggling the demands of the generation below, the generation above. Many of us are navigating hormonal changes. And so we are also needing to look after our health, which compounds into our weight as well. So it's not as simple as eating less and moving more. We need to think beyond that when it comes to our weight.
I feel like I just heard a collective spiritual sigh from our audience being like, oh, thank goodness. Thank goodness someone can see me, someone hears me. Why is it that weight loss, conversations about weight itself as a topic, why do you think that remains such a sensitive issue for so very many of us?
Unfortunately, when it comes to weight, it can be a really difficult topic to have. And I think that when it comes to stigmatizing topics, whether it's got to do with your menstrual periods, whether it's got to do with your mental health, people will either come to you and you'll have a really great conversation because they've been there themselves, or you're going to be surrounded by a lot of noise and a lot of misinformation. And unfortunately, that repels people. When you go to someone and you're like, can I have help with my weight? And they say, oh, just go and eat less and move more, or it's as simple as calories in and calories out. And they're really minimizing the situation for you and you're kind of turned away. That makes you feel small, and that makes you feel like people don't care about you and they're not going to help you with your situation. But when you can find someone who's going to listen to you, who's going to think about your situation, who's going to assess you not just as a person with a certain BMI, but a person who, is looking after a family, who does have certain medical conditions, who is juggling, all of these different demands, that's when people feel heard, and that's when they can actually have the courage to take their next step and to actually make sustainable changes when it comes to their weight.
Sustainable. I feel like that's a word that we're going to be saying a lot during this chat. How would you describe what you do? So if you're meeting someone for the first time and they say, Angela, what do you do?
Sometimes I introduce myself very quickly and I say, oh, hi, I'm Dr. Angela. I'm a weight loss doctor. And they very quickly assume you're one of those people that prescribes lots of weight loss injections. You're one of those people. And you know what? There is a lot of stigma when it comes to being a weight loss doctor, because sometimes we're seen as those people who just give out prescriptions like they're candy, like they're cookies these days, without necessarily, using them like a Band-Aid approach, and not even thinking about the long-term effects or how we're going to help patients have a sustainable approach when it comes to their weight. If they give me another second to talk about what it is that I do, in that I lead a multidisciplinary team and we take a holistic approach to their weight. We help patients understand the underlying factors contributing to their weight. What are the drivers of their weight, and what is the reason why they've struggled with their weight up until this point? And in addition to that, yes, we may kickstart them with some weight loss medications to get the ball rolling, in addition to getting their lifestyle factors optimized. So getting them with the right nutrition and helping them to do strength-based exercise, which is often going to be the best form of exercise for them in the long term. Then they start to ignore that kind of trigger of when it comes to, oh, Dr. Angela is a weight loss doctor. And they start to see that maybe she's a weight loss doctor that's seeing weight in a different way, because she's trying to help people overcome their weight challenges so that they won't necessarily have to be patients. They won't necessarily have to be sick people in the long term. They're actually people who are going to optimize their weight and graduate from her care and be able to look after themselves in the long term.
Where do you think that judgment comes from, that initial judgment of you calling yourself a weight loss doctor? Where is that coming from people?
It comes from, I think it comes from weight itself just being a very polarizing topic, just like menopause is a polarizing topic, just like mental health is a polarizing topic. And it's polarizing not just for the patients, but also for the doctors who work in that field as well. Patients experience a lot of stigma and a lot of discrimination. Back in the day when we had shortages with the weight loss medications, and they could only be dispensed to patients who had diabetes, many of these patients would be going into the pharmacies trying to fill their script. And all they're trying to do is fill the script, like a blood pressure script, an asthma puffer. And all they're trying to do is improve their health. And they're being judged saying, you don't deserve this. We're only dispensing it for patients who need it for diabetes, and they're being turned away. And often they're going to feel terrible because all they're trying to do is improve their weight and improve their health. So patients who have been trying to optimize their weight do experience a lot of stigma and a lot of discrimination, and it's been really hard for them for a very long time.
Part of that discrimination is that kind of stereotypical response of, well, it's the easy way out. It shouldn't be that easy. It needs to be hard. That's great. That's insane talk, right?
It is. And there is a lot of shame.
Yeah.
There is a lot of stigma. And often people who struggle with their weight are seen as lesser quality people, sometimes by the people who love them their most. So
even by themselves.
Sometimes by themselves as well. So sometimes when they're sitting amongst their family, they're seen as someone who doesn't value their health, or someone who just can't stop eating, even though they might be eating the least amount out of everyone else at the table. So it can be quite a struggle for many patients, and it's no wonder that often they delay their care and it takes so long for them to reach out and actually ask for help.
Let's fix some of this misinformation that's going around. Starting off with just the basic concept, the basic definition of a GLP-1 drug. What does that mean?
Yeah. So the definition, let's talk about what is a GLP-1 medication. A GLP-1 medication stands for a glucagon-like peptide 1 medication. What is it? Okay, so it is a medication that comes from the diabetes family of medications, and it works in a couple of different parts of the body. So at the level of the brain, it reduces your hunger, but it also reduces your food noise. So you're not constantly thinking about food. You're not like waking up in the morning and thinking, oh, I got to have breakfast. And then at morning tea, you're thinking, oh, when is it lunchtime? I'm actually starving. What am I going to have for lunch? Should I go down and have a banh mi? Should I have a sushi roll? No, I shouldn't have a sushi roll. That has too many carbohydrates. Wait a minute. What am I going to have for dinner? And it's this constant cycle, constant guilt, going to and fro. And then when they do have a GLP-1, it's like the radio's been turned down. They're like, actually, my fridge still has food in it and my pantry still has food in it. And it's 3 o'clock. Oops, I forgot to have lunch. And so they have a reduction in food noise. So that's how it works at the level of the brain. At the level of the stomach, it slows down your digestion so that you do feel fuller for longer. And as a result, it can have a couple of side effects like reflux and delayed gastric emptying. At the level of the lower gut, it can result in a change in your bowel habit. So some people do have constipation, some people do have diarrhea. But as you can see, it's working in multiple levels of the body. And as a diabetes medication, it's improving your insulin sensitivity. So these GLP-1 medications are working like diabetes medications, processing your sugars in a different way. They're improving your food noise, they're reducing your appetite, and as a result, many patients are losing weight, but they're also given an opportunity to be able to change their behaviors. And I think that's what's key here. For some people, when they're using them as Band-Aid solutions, they're like, I need to lose weight. I know, I'll go and get a script from a GLP-1, and they're just simply using the medication. That's not going to result in sustainable weight loss. Yes, they might get to their goal weight, but are they planning to use it forever? Whereas if you're using it as a tool and you've got wraparound care, in that time when you've got reduced food noise, in that time when you've got reduced appetite, then you're going to optimize your nutrition, your exercise, address your sleeping issues, address any other supports that you need. That is how you're going to have sustainable weight loss in the long term with the GLP-1.
So it's the holistic approach.
Correct.
We have to be thinking about everything, not just I'll take this and therefore I'll lose X amount of kilograms and I'm going to be at my ideal weight forever and ever and ever.
Correct.
Right. What's the difference between the different brands? Are they called brands? Do we call them brands? Medication? Because I feel that there would be this overwhelming it's not knowledge because I don't think it's true, but I think we take it as a fact that Ozempic, for instance, people, they're on Ozempic, meaning that we think that that's what the drug is called. We think that is the actual medication, but that's a brand.
Correct. So I would say that GLP-1s are sensationalized. They're all over social media and everyone is super excited about the GLP-1s, and Ozempic tends to get the most noise out of all of the medications.
Is that just because it was the first one, or why have we latched on to that term?
It's often just because there's been a lot of articles or there's been a lot of celebrity use of certain types of medications, and they've also just tended to be the loudest.
Okay.
When it comes to GLP-1s, though, they've actually been around for quite a long time. So they've been around being used as diabetic type medications. Earlier on, we did have one that was being used injected daily, and that one was called Saxenda, and it contained the medication called liraglutide. After that, we had Ozempic, which contains semaglutide, and that one was registered for diabetes. And that's the one that's been all through the media and sensationalized and very noisy. After that, we had Mounjaro, which is a dual GLP-1 and GIP receptor medication, and that one contains tirzepatide. And since then, we've also had a similar one to Ozempic, which is called Wegovy. So that one also contains semaglutide inside there, but that one's been registered for weight management. So it seems quite confusing to someone who's on the outside, which is like, GLP-1s, why there's so many names. It's kind of like Panadol and paracetamol.
Okay.
The ingredient inside there is paracetamol. But if you go into the chemist, I'm sure you'll find many, many different brands when it comes to paracetamol. They're just different brands made by different companies, and sometimes they can be a little bit different. But overall, we say that they belong to the GLP-1 family.
Okay. So it's not necessarily that your doctor may prescribe you something like it could be Ozempic, but then you should maybe be on Mounjaro instead of that? Or is it like a trial and error? Or is it just like your aim is just to have a GLP-1 if you need it?
Yeah, the GLP-1s as a family all work in a similar way, but there are some subtle differences between them. So, for example, some of them are daily injections, whereas some of them are weekly injections. Some of them are more effective for the treatment of diabetes. Some of them are more effective when it comes to weight loss. Some of them have less gastrointestinal side effects. And this is where I think it's really important for patients to have that individualized conversation with their GP, because their GP is always going to know them best. They're going to know, okay, did you have a lot of morning sickness during your pregnancy? Do you have a really low nausea threshold? And maybe for that reason, we would put you on a medication that doesn't cause so much nausea. Or are you someone who has had hemorrhoids in the past and is prone to a lot of constipation? Maybe we would look at one that minimizes constipation for you. So I think that, as the general public, we don't need to get too caught up in the fine details of the differences between the GLP-1s. We just need to have a broad understanding of what they are, what they do, and then have that individualized conversation with our GP.
And we don't need to be afraid of it, because I feel that sometimes that fear is what drives that sense of shame, whether or not you put that on someone or your own shame, because you're not aware of what it is.
Correct. I think having these kind of open and honest conversations where it's acceptable to learn and to be empowered with information and to know the pros, the cons, and the options, this is the best way to learn about what's out there and what might suit you. And then you go narrow and you think about what exactly suits me for my situation with my GP. So I think that's fantastic.
How do you know if you potentially qualify or should think about GLP-1s as an option for you? What are some of the signs?
So that's a really good question. And I'll tell you the old way and I'll tell you the new way.
Oh, okay, yeah.
Because I think that there is a lot of misinformation out there about who qualifies and who doesn't qualify.
And we're still learning, right? Like we're still getting, the more that people have this treatment, the more sample size, the bigger the sample size, and then you can kind of garner these kind of research.
Correct. So I think back in the day when we, even as GPs, even as prescribers, back in the day when it came to GLP-1s, we used to think patients can only be prescribed GLP-1s if they are obese, i.e., if they have a BMI that is over 30. And that's a very fixed mindset. That's a very flowchart approach to assessing someone. And we know that the BMI is not the be-all and end-all. The BMI is not very useful, for example, for people who have a great muscle mass. The BMI is not very useful for people who come from different cultures and might have a different bone density or a different muscle mass or fat mass. So how can we judge someone or assess someone simply based on their BMI? These days, I think what's much more important is to think about someone in terms of their health risk and in terms of their health goals. So I might have a woman standing in front of me and she might have a BMI of 29.9. And if I had that old way of thinking, I'd say, you don't deserve a GLP-1. Your BMI is only 29.9 and I'll see you when you're over 30.
Wow.
How unfair is that? But if I think a little bit further and I dig a little bit deeper, I might find out that, well, actually, in her pregnancy, she had insulin-dependent gestational diabetes. She had to do injections 3 times a day and she had a very big baby. And also, earlier in her life, she had polycystic ovarian syndrome. So she is actually a woman who, what I would say, is on the insulin resistance spectrum. She is someone who is at risk of developing diabetes much later in life. And what is the harm in treating her about 6 to 12 months earlier than when her BMI gets to 30, and helping her turn around her life now so that she can actually look after her weight and maintain a healthy weight in the longer term. So I think that we don't need to have such fixed thinking when it comes to the BMI and when it comes to prescribing. We don't need to judge someone based on their BMI. We need to think about our patients and women in particular when it comes to their entire health risk and what their goals are in terms of optimizing their health in the long term.
It's about quality of life as well, right?
It is, definitely.
We've talked about the noise that exists around the negativity that sometimes is around weight loss medication. What about the positivity? How can this medication be so life-changing for patients, in particular women?
There are many different cases that I can think about right now where a patient has come to see me because they want to they wanted to improve their weight, but actually they've had so many secondary benefits. So often when I see them for their initial consultation, it's just about the numbers. So, they might say to me, I'm starting at 100 kilos and ideally love to be double digits. Or they might say to me, I'm 120 and I literally don't remember the last time that I was 110 kilos. So for many patients, their short-sighted goal might be kilogram loss, but the health benefits that happen afterwards can be absolutely amazing. I actually had this one woman who was literally in her early 30s and she had been trying for a pregnancy for about 2 years. She was referred to me by her fertility specialist who said that, Angela, I would love for you to prescribe a GLP-1 for this woman because her BMI is 41 and she just needs to be a BMI under 40 so that we can get her fertility treatment. She can have her IVF and then I can get the party started. I just need you to give her some GLP-1s. And she thought that I was a weight loss doctor who gives those GLP-1s. And I said, okay, let me try my magic. Well, anyways, we didn't just give her some GLP-1s. We identified that she actually had underlying polycystic ovarian syndrome, something that had not necessarily been seen or addressed by her GP prior to that or her fertility specialist prior to that. And we treated the polycystic ovarian syndrome from a medical and from a nutritional perspective, got her strength training, kickstarted her with a GLP-1, and she actually got pregnant naturally and didn't even need to have her IVF. And I think the benefit of that was that had she done IVF at a BMI of 41, she would have had a more at-risk pregnancy and then she would have been at a higher weight in her postpartum period. But because she was lighter when she got pregnant, she actually had an uncomplicated pregnancy and an uncomplicated postpartum period. And now she's actually able to manage her weight without anything. So I think, this kind of multidisciplinary approach is something that is very, very rewarding, not just for me, but also for the patients as well.
It sounds like a puzzle and potentially GLP-1s are just one piece.
Correct.
And you need to have many other pieces to build a successful puzzle.
I tell my patients it's like building a house and we need to actually get the foundations correct first. And the GLP-1 is literally the cherry on the top. Like it's literally the last piece of the puzzle because many patients are attracted to come and see me because they want to be prescribed a GLP-1 by Dr. Angela. And I say, I'm happy to prescribe a GLP-1, but let's also treat your medical condition and let's also optimize your lifestyle. And we'll put the GLP-1 on at the end. It is very much a systematic approach.
What do you think, though, are some of the most unrealistic expectations when it comes to starting the GLP-1 medication? Do you think it's in my head, so we take this immediately, I am a runway model? That's silly.
That's not silly at all. But one of the unrealistic expectations that I sometimes hear, not necessarily from my patients because I give them very good patient education first, but one of the unrealistic expectations that I hear is that I'll take this first injection and I'm immediately going to have appetite suppression. And if I don't immediately have that, maybe I should increase the dose on the second go. And if I don't have an appetite suppression with that one, maybe I should immediately increase the dose on the third go. So the first thing to say is that for any of you listeners out there, The first few weeks of taking these medications are not actually weight loss doses, and they're not designed to be there to suppress your appetite. They're actually acclimatization doses. It's for you to acclimatize your body to the medication so that you're not having too much bloating, nausea, reflux, or constipation. So in the first couple of weeks, you're actually supposed to feel nothing. And if you do feel a little bit of bonus, reduction in food noise or reduction in appetite, just take it as a bonus, but don't feel the need to rush the upwards titration process, and just follow the due process with your GP. Don't be tempted to suddenly start a double dosing or suddenly start increasing the dose, because you can get very sick that way.
I feel like you must have so many conversations with people who just want everything now. I say that as someone who is me. I was like, as a culture, I think as a society, we're so used to just like immediacy. We want it. We're like addicted to the immediacy of everything. Is that half your day? Just being like, no, now, just let's take a second.
Sometimes patients are very keen to lose weight very quickly. But at the same time, if I make sure that our values are aligned and what they want is actually sustainable weight loss, then I can get them back on course and make sure that they see the big picture. Because many times, by the time that patients come for medical weight loss, they have exhausted many other lifestyle options. So they have actually tried many fads. They've tried many ways to lose weight rapidly and also regained the weight rapidly as well. So they know that they really want to invest their time and their energy into doing it right, so that this time when they do get to their goal weight, they're going to be able to keep it off. So I do remind them that it is an investment in your time. We do have to be patient. We do have to let the medications work, but it is worth it ultimately in the end.
This isn't a fad.
No.
This type of medication.
It is a treatment.
A treatment. What are the most common side effects?
Yes. So the most common side effects, and not everyone experiences a side effect, but the most common side effects are gastrointestinal side effects. So in your gut. So you're going to experience bloating, nausea, reflux, constipation, or diarrhea. Now that doesn't sound very pleasant.
No.
But not everyone experiences it. And often it's not at the low doses when you're starting the medication. Often it's when you get to the medium doses that you might be experiencing those side effects. But there's many things that your GP can do to adapt. So they might get you to take the medication towards the end of the week, like a Thursday or Friday, so that you experience those side effects at their peak on the weekends. Or they might get you to split your dosing so that you're not having a peak in the middle of the week and it's more stable throughout the week. So if you're ever experiencing side effects, know that you don't have to struggle through it. You don't have to soldier on. You don't even have to keep powering through and keep increasing the dose with increasing side effects. You just have to talk to someone, and there's many things that we can do to make it better for you.
How does GLP-1s, how do they affect, or do they have an effect on your hormones? So for a substantial part of our audience, they will be female listening to this. So if a woman is thinking of taking this medication, of undergoing this treatment, what could she expect, or how could it affect her hormones, whether that be her cycle or whatever stage of life she is at?
Yeah, so I would say that I would break this down into two phases of life. So one phase of life would be women in the reproductive age who are planning for pregnancies. For women who are at a heavier weight, looking to start a pregnancy, for example, who might be having conditions like polycystic ovarian syndrome, what we find is that when they lose weight for any reason, be it a GLP-1 medication or with bariatric surgery or with lifestyle interventions, any type of weight loss is going to improve their menstrual cycle. So they might find that they are quite far apart, like 50, 60, or even further numbers of days apart, and then the cycle contracts and becomes shorter. Then I also see women who are at that later stage of life who may be in that perimenopausal stage of life. And perimenopausal, by the way, does not begin when you are 50 and lasts for 12 months, which a lot of women think. Perimenopausal can be in your 30s. It can be in your 40s. And for some women, it's actually really subtle. It's like a sudden change in your flow. It can be a little bit lighter, a bit heavier, bit more frequent, bit less frequent, and then a few other subtle things like waking up in the morning, not being able to go back to sleep, having a few aches, pains, being a bit more irritable, or even feeling a bit more anxious. And so these are really subtle things. And often women will not think, oh, I'm perimenopausal. They'll think I'm underslept. Gosh, I'm grumpy.
Yeah.
I'm juggling too many things. And they'll think it's everything except perimenopausal. So when it comes to women who are navigating the perimenopausal change, they are often navigating hormonal changes where they're experiencing central weight gain. That's when they're having asymmetrical weight gain. It's all in their tummy, it's all on their breasts, but when they're working out and when they're dieting, they've still got very skinny arms and very skinny legs, and they feel very disappointed with all of their efforts, and the scales aren't changing. So when they do lose weight, again, regardless of whether it's a GLP-1, bariatric surgery, or lifestyle intervention, they feel so much better. Feels absolutely amazing for them. So yeah, I would break it down into those two groups.
How long do we or should we be on these medications? Is it safe to be on them long term if we're looking at it at that sustainable aspect or with that sustainable lens? Should our aim be to eventually come off them, or are you perfectly safe to just be on them forever?
There are two schools of thought when it comes to this. I would say that some patients will be taking these medications lifelong. For example, patients who do have diabetes lifelong, and they'll be taking the medications, generally speaking, lifelong. And we know that these medications are registered to be used lifelong, and they're safe to be used lifelong. When it comes to weight management, there are some doctors who would say obesity is a chronic disease, and therefore you should treat it like all other chronic diseases, like asthma, like high blood pressure, and just treat it lifelong as well. I'm of a slightly different mindset where I think that certain patients would be using it in the longer term and certain patients would be using it in a kickstart approach. In my experience, about 80% use it in a kickstart approach and about 20% use it in a longer period. And that's because most patients have reversible factors when it comes to their weight. They've either got underlying medical issues that need to be managed, like insulin resistance or thyroid disease, or we need to address their emotional eating with food, or they've got some kind of past trauma or relationships with food. So for most patients, I can usually identify that they've got some kind of reversible issues that we need to help them manage. And so we're going to kickstart them, get them to their goal weight, and then wean the medication down. For the last 20%, they usually have some kind of ongoing driver contributing to their weight. And it makes sense to take one GLP than to take multiple medications for something else. So they might be one of my patients who is taking long-term antipsychotics for their mood, which causes weight gain. Or they might be taking steroids a couple of times a year for their rheumatoid arthritis. And these medications cause weight gain. So sometimes knowing that these patients are going to be gaining weight, it makes sense for them to be on a low-dose GLP-1 by the time that they get to their goal weight, rather than them getting high cholesterol, diabetes, high blood pressure. So it's an individualized approach that we take with each patient, but for the great majority of my patients, it's not always a lifelong medication.
And when you come off it, if you wanted to come off it, do you then does everything come back immediately, or is there still the habit that you've learned? So in terms of your appetite, is it's not coming back at your food noise isn't super loud again? Would you expect that you've kind of built a habit that it's not so loud anymore?
It's actually so important. The weaning phase is much harder than the losses phase or the maintenance phase.
Okay.
Yeah, so there's different phases when it comes to using a GLP-1. People get really excited about starting a GLP-1 and they're like, this is my answer to everything. This is what I've been waiting for. I've come so far in, getting the courage to ask someone for a script for a GLP-1, and now I'm taking it and this is fantastic. But the losses phase, even though they're scared about having these gastrointestinal side effects, the losses phase is actually easy. All that you do is go up and up and up and up until you're having effective percentages of weight loss. But the maintenance phase is easier, but actually it's the weaning phase that is actually the hardest, because the weaning phase depends on you having already had all of those lifestyle factors optimized and you maintaining it. So you really already need to be in a good habit when it comes to your sleep, your nutrition, and your exercise, because the medication is going to be coming down and a little bit of that food noise is going to be coming back and your appetite is going to be coming back somewhat, unless you're able to control that with your protein. So the weaning phase can be much more tricky and patients need to be prepared for that.
Is there emotional side effects when it comes to people who are on GLP-1s or coming off GLP-1s, or even just their relationship with weight loss itself? It is such a sensitive topic for so many people. So I can imagine so many of your patients feel quite differently about it too.
Definitely. Any forms of weight loss can result in lots of emotion, regardless of whether they're doing it this way, which is the GLP-1s, they're using lifestyle changes, or they're having bariatric surgery. It's just that I guess GLP-1s get a lot of noise because patients are having very effective and quite timely weight loss. So this can result in, I would say, a big change in identity for a lot of patients. They're looking in the mirror. They've lost a significant amount of weight. So they might have lost, 15% over 4 months. And who do they see in the mirror? They actually see their original selves. They still see themselves at their starting weight. They still see themselves as their starting shape. They can't necessarily see that 15% loss. And because of that, they're still wearing the same clothes. They're still doing the same things, and they can't see the positivity in it yet. Sometimes it actually does take a full year by the time that someone has achieved 15% here and 15% there. And I tell them, a third of your body is missing right now. How does that feel? They're like, oh, it's okay, but I don't really quite notice it just yet. Yes, my underpants were falling down and I did need to buy some new clothes, but it hasn't quite sunk in. And I still feel like a bit of a fat person. And sometimes they admit that their relationship with themselves hasn't yet healed and their self-identity is still their original self. So it takes a little bit of time for the mind to catch up, even though the body has changed.
How do you find your patients are, especially women, when it kind of does register? And they get that, oh, hang on, I've implemented all these changes. I've taken all of the steps. I'm on the GLP-1. I've built the whole framework. When that sinks in, what are they like?
Well, one test that I give my patients to do is, it sounds like a really funny test, but I tell them, okay, you can't see it. That's fine. What I would like you to do is to, between now and when I see you for your next consultation, I like you to go and fill your backpack with some canned beans and also with some books with about 30 kilos. And I want you to carry it around for the day and then tell me how you went when I see you for your next consultation. And when they do that, they actually have some feedback. So they actually know, oh, I remembered, now I remember what it was like going up and down some stairs, what it was like to bend down when I had an extra 30 kilos on my knees, on my hips, on my ankles. I remember what it was like to bend over and clip my toenails or get up when I was sitting down off the floor. That kind of tactile feedback is different to that visual feedback that they have, and they start huffing and puffing when they're doing certain things. So for certain patients, if they haven't yet had their brain catch up to their new physical identity, sometimes I give them a little bit of a challenge and then they realize it and they can finally see that functionally I'm a completely different person to how I was before. I'm free. I can go on holidays. I'm not even carrying a backpack on me all the time. and they can start to think about the way that they want to live their life going forwards. In the past, I would have never gone to a swimming pool because I didn't want people to see me in a swimsuit, or I wouldn't go to the beach, or I wouldn't go to the shopping center because I assumed that there would be no clothes that would fit me. So their entire attitude to themselves and that relationship with themselves completely changes after that.
They're meeting themselves again, maybe.
Exactly.
I'm learning so much, Dr. Angela, and hopefully you are as well. If you're enjoying this episode of Fernwood Unfiltered, make sure that you share it with all of your friends because I can guarantee that they'll be just as interested as you. We'll be right back.
Looking for a gym that's welcoming, safe, and just for women? You have to experience Fernwood Fitness. Designed for women, by women, our clubs have everything you need under one roof. World-class strength training, reformer Pilates, yoga, luxurious change rooms with daily essentials, and even a members lounge with tea, coffee, and complimentary breakfast. Book a free tour today and feel the Fernwood difference for yourself. Visit fernwoodfitness.com.au.
What would you say are some of the biggest misconceptions when it comes to GLP-1s and the people who decide to take them?
I think one of the biggest misconceptions is that the people who are taking GLP-1s are all just taking it for a shortcut or for vanity reasons, when in fact, the great majority of people who are taking it for health reasons. When I see patients and we try and figure out the underlying factors contributing to their weight, there are actually so many medical conditions that are contributing to weight. Some of my patients have underlying pre-diabetes or diabetes. They have insulin resistance. They have a thyroid disease. They're taking medications that are contributing to their weight. There are actually so many medical reasons why people are taking these GLP-1s, and not everyone is taking it to have a bikini body or to lose weight for their wedding or taking it for the wrong reasons. But often it's those people who are making the most noise in the media, and that's the reason why we get a lot of misinformation.
Let's reframe it then. For everyone listening, what should our first reaction be, or what would you like it to be when we are talking to someone and they say that they're on a GLP-1, or we see a video saying that, oh, yep, they're on Ozempic, Mounjaro, or what? How should we react?
Congratulations on doing something good for your health. I think that we would say that to anyone who says, I'm taking my asthma puffer today. Congratulations on doing something good for your health. Would you say to someone who's taking the asthma puffer, I bet you're taking it for something else, and just judge them? I think there's no need for that. And I think that we need to be supportive of people trying to improve their health, even if they're trying to do it for their weight. Ultimately, it's because their weight is going to improve their health.
Okay, let's talk about trying to retain or maintain or increase that strength then when you're on the GLP-1s. Is it more, less, similar importance to be strength training?
It's incredibly important. Some people think that it's just about taking the GLP-1s, it's just about taking the medication, and they completely disregard the lifestyle changes. But strength training is incredibly important. Some people think that it's just about going on the treadmill and getting your heart rate up and burning lots of calories. But actually, strength training is one of the most effective ways to be able to not just control your weight, but to be able to look after your bone mass and also to be able to support your muscle mass, which in turn supports your metabolism in the long term as well. So I always encourage all my patients who are undergoing the weight loss journey to do some form of strength training. And it doesn't have to be lifting heavy weights. People always think, oh no, strength training, is that going to be powerlifting? Am I going to look like a bodybuilder? Am I going to be having to carry heavy weights? Strength training can be as easy as walking with 2 water bottles and having an extra 1.2 kilos of upper body weight. Strength training can be as easy as, having canned foods. Strength training can be as easy as dumbbell exercises at home or, going to classes in the gym. So strength training is something that is so important when it comes to the weight loss journey, because it's not just about getting smaller, it's about getting smaller and stronger and maintaining that muscle mass towards the end at your goal weight.
I feel like there has to be a lot of honesty here when it comes to the patient themselves, but also maybe a sense of bravery, because if they're already holding on to their own internalized stigma or negative connotations when it comes to these or being on weight loss medication, and then opening up to not just their GP or their doctor who's prescribing it to them, but also then a nutritionist, and then also then maybe a personal trainer. How can someone go about having these conversations in an empowering way and not feel like it's a bad thing, because we need a village to keep the sustainable weight loss?
We definitely do. And sometimes it's about the patient facilitating that conversation and letting those healthcare providers talk to each other, because I feel like sometimes patients have been given too much burden to bear when it comes to facilitating this. Patients don't always have all of the lingo, and patients don't necessarily know all of the things that the different team members need to do or what their specialties are. And so sometimes the best role for the patient is actually to just get the party started and get everyone to start talking to one another. For the GP to say to the nutritionist, look, I've prescribed the patient on this medication. In the next couple of weeks, they might be a bit nauseous. Can you adjust their nutrition for that? And also, they might only have 30 to 50% of their appetite. They may not be able to hit their calorie target. Can you adjust it for that? And the patient may not necessarily know what they got to do when it comes to their exercise, but maybe they can facilitate that conversation between their GP and their PT or their exercise physiologist and say, hey, I've been prescribed a GLP-1. Would you mind having a chat? So the GP can say, look, they've been prescribed a GLP-1. What's really important here is that they're not going to lose their muscle mass. In addition to whatever you're doing for their general health, can we include some strength training in there? So I think the role of the patient sometimes has been to, do too much. And it's been very, very hard for them to even find the words. Yeah. But I think the role of the patient should actually be to just bring everyone together.
Can you give us 3 clear rule of thumb kind of steps or pieces of advice to thrive on a GLP-1?
Well, I think the very first thing to do is to understand if you have any underlying factors contributing to your weight, rather than just skipping to having the GLP-1 by itself. And that would involve having a chat with your GP to see if there's anything that needs to be checked beforehand or anything that needs to be addressed at the same time. The second one would be to optimize your nutrition. Even patients who, I might take their food diary at the first consultation and they say, oh, you won't need to give me any nutritional advice. I have a degree in this and a degree in that, and I have a perfect nutrition. They don't realize that when they take a GLP-1, things will change. They're going to have less appetite. They're going to have less food noise. They might be navigating some side effects. And so they're still going to need a little bit of nutritional support so that they can be well and they can maintain their muscle mass. And last but not least, movement and exercise. So helping patients to not see exercise as a way to lose weight anymore, which is how they've traditionally always seen it. For many patients, exercise is about burning calories to get to your goal weight, but it should actually be about living your best life, exercising for good health, and in this case, when taking a GLP-1, to maintain or improve your muscle mass in the long term.
What are some of the stories of your patients who are on the other side now and they are just living a different life? How has it affected them?
I've got a few of them, and for many of my patients, we actually keep in touch in the long term, because when I originally created the program, it was supposed to be for 20 weeks. And then many patients were like, oh, I actually need to see you in the long term for my metabolic health. It's not about weight loss anymore. It's about checking in, every 6 or 12 months, doing a blood test and making sure that I'm staying at my goal weight. And so for many of them, it's about being about 20, 30% lighter, being independent with activities of daily living, getting pregnant, having a baby, having no complications during that pregnancy. For some of my patients, it's about reversing their chronic diseases. I've had some patients who actually came to me originally and they were taking about 5 medications, and we cut them down to 2 or 3 medications. I had a younger woman who was in her 40s, and she was so embarrassed that when she went on holiday with her daughter, they couldn't twin share in a room because she was wearing a sleep apnea mask, and it made her so embarrassed. She just felt so felt like an old lady, felt like it was like a life support machine. And when she lost weight, she reversed her sleep apnea because she no longer had all the crowding around her nose and mouth. And for her to have that freedom and to be able to go on holiday, share a room with her daughter, it was actually life-changing for her. So for many of my graduates, yes, originally they wanted to lose weight. Yes, they wanted to have a kilogram goal. But to be able to see them on the other side and to be able to live their life with all of these non-scale victories is absolutely amazing.
It seems to me, Dr. Angela, that I cannot open any social media platform. It could be TikTok, it could be Instagram, who knows, it's probably on LinkedIn. And I can't just scroll without there being some kind of mention to an Ozempic or a GLP-1 in some variety. Is there anyone that GLP-1s aren't for, that people shouldn't consider? Because I have to admit, sometimes I look at my feed and I see people and they're like, oh, yep, I've just jumped onto the GLP-1, and they're like my size, and I wouldn't necessarily think that I would need to go on a GLP-1.
Yeah, I think that GLP-1s should not be used by people who don't necessarily have a medical indication and who just want to use it for a short intervention where it's like they're trying to use it for the appetite suppressant effect. So, back in the day when people would go out there and buy an appetite suppressant because they have a wedding coming up in 6 weeks' time, and they're like, I know, I need to fit into my wedding dress. I'm going to take this appetite suppressant for 5 weeks, lose this many dress sizes and be able to fit into my dress. So that kind of mindset of being a healthy person with no medical comorbidities and simply doing it for size, these medications are treatments and they shouldn't be used in that fashion. They should be used for patients who have a medical need and when we're treating an indication.
Do you worry that people led by social media are doing the opposite though?
I wouldn't be surprised if there are some people who are using it in that way because it is very popular and you can see it everywhere.
But you shouldn't unless you need to. Where can people find you, Dr. Angela? I mean, in terms of, we've talked about the misinformation that exists when it comes to GLP-1s because we're constantly bombarded with all of this quote unquote information online. What are credible sources? What would you recommend? How can we find you?
Yeah, the best way for people to find credible sources of information are usually their regular GP. And I say that and I sound like I'm harping on and constantly recommending people to go and see their regular GP, but it's because health is just so individualized. Yes, we can go to look at certain websites to look at the pros and cons of medications, to look at the side effects of medications, but the best conversation that you will ever have is by someone who knows your health risk and by someone who knows what medical conditions that you have and by someone who knows what medications that you take, because then they can actually take a personalized approach and recommend, is this right for you? And if so, which one is going to be the best one for you? So I think a individualized consultation with your GP is always going to be the best way to go. In terms of where to follow me, you can always follow me on Instagram. My handle is Dr Angela Kwong and my website is enlightenme.com.au.
Dr. Angela, what would one final takeaway be that you would love for our listeners to know?
I think that you should be kind to yourself and not worry too much when it comes to all of the noise when it comes to GLP-1s. Yes, there is a lot of noise. Yes, there is a lot of negative noise and a lot of misinformation when it comes to GLP-1s, but these are medications that are really changing the way that we see options when it comes to weight management. For such a long time, we have only had limited options. We've had lifestyle options, we've had bariatric surgery, but we haven't had something in between where women have had a choice and women have had that option. So I think we don't need to be too scared by some of the polarizing views that are out there, by some of the misinformation that's out there. We just need to look at ourselves and sometimes have that conversation with the prescriber who knows us best and have the courage to take that next step.
Dr. Angela Kwong, thank you so much for joining us for this very unfiltered chat. I appreciate it.
Thank you so much.
And if you have loved this conversation, as if you wouldn't have, make sure that you share it with the people in your life who you think would get a lot out of it. Until next episode. Thanks for listening to another episode of Fernwood Unfiltered. Just a quick note that the information shared in our episodes is for general educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. So always seek the guidance of a qualified health professional regarding any medical condition or concerns you may have. Catch you in the next episode.